A lot of medical fit outs at AC Fit Outs, I'd say it's one of the areas that we would classify ourselves as specialists of. And there's a lot to take into consideration when designing and doing a fit out. And the number one thing is working with the doctor and understanding his business and what he needs to get out of the medical centre and the fit out. And that might be as simple as working out how many doctors he's going to have in his practice, and how big his doctors require their consulting rooms to be, whether or not they need a treatment room, and whether or not they want a staff kitchenette or breakout room at the back. And then most importantly, it's running the numbers through how many doctors you have to then calculating how many patients they want to see on a daily basis and how many patients they're going to have in the waiting room. Then calculating out to make sure we've got enough seats and space to fit those patients in. But then, and I think another important thing is, and we're definitely seeing a lot more with medical practices recently, is they're not as clinical as they used to be. So they're starting to throw in a little bit more interior design to make people feel more comfortable when they're going to the medical practice. And that might be as simple as having a painted feature wall, or having a green wall to break up some of the colour to offer a bit of warmth, or having TVs scattered through the waiting room with TV on to occupy people while they're waiting. Having a nice featured reception area rather than just something white and clinical. So we're starting to see a lot more emphasis in these medical centres to make them feel a little bit more warm and welcoming.